Hello, I'm David Kennedy. You're watching Poland In. Medical cannabis is an area which is still a legal grey area, but nevertheless, since 2007, there has been the ability to trade in the product. I'm joined today by my guests, Andrew Makatrewicz-Deroy.
Hi, David.
And Michael Klepacz,
who
are from the Central European Cannabis Forum. Now, the issue of medical cannabis, I mentioned it's a grey area still. Andrew, perhaps you could tell me, where does the law stand in that regard?
The law in Poland is actually quite progressive by European standards. So medical cannabis is legal. It has been since 2017, but it's still unclear what the government position is on it. There's obviously a lot of resistance. There's a lot of issues. There's still a lot of medical clinical trials that need to be done. And at the moment, medical cannabis patients aren't really being served because there's very few pharmacies that have the product, and it's extremely expensive where it is.
Right, expensive. So if you were a patient who wanted to have cannabis to help you, how much would the costs be for a month's treatment?
Again, it's like with patients of any kind. It's the amount of medicine you need is dependent on the disease. So the diseases where cannabis has been shown to be extremely effective include epilepsy, multiple sclerosis, cancer, anxiety, sleep disorders, and each requires a different type of product and a different dosage of the product. But to answer your question, I guess the average patient right now would need 250 euros a week.
250 euros a week,
which is for a lot of people. In fact, people that are chronic sufferers of disease and maybe aren't able to work as much, and of course the older people as well. So the people, for example, in Canada, which is one of the most advanced countries for medical cannabis, the fastest growing age bracket and people, the demographic which is really starting to use medicinal cannabis is women over 65. So a lot of these types of people are using it, and the cost is a very significant issue, especially if you compare how much lower it is on the black market.
Right. Now, the legality of cannabis is something which has been a political issue as well. There was one particular politician who brought things forward. What was the situation with it becoming legal?
The situation with it becoming legal was about a young boy who had a mixture of seizure disorders and Down syndrome, and he was basically on his deathbed, as far as I understand, and his mother took this up politically, and the torch was carried forward, and the science is there that cannabis can help in many cases. I myself personally have a friend who was seizure-free for over 5 years, just using medicinal cannabis. And 2,000 years ago, they'd be considered a miracle, but somehow we're still doubting the strength of cannabis.
Now, there's a certain amount of support for medical cannabis within the medical world, but the key criticism always is that there hasn't been enough clinical testing of the effectiveness of it. Is that always going to be a barrier?
I think in the United States we have a big problem because it's considered a Schedule I substance, even though in 1999 the Department of Health received a patent for cannabis for use with brain issues. But then when you look at Israel, within Israel, that's where they discovered THC back in the 1950s. They have a very large medicinal program with many studies. And I think really what we have is just a transparency issue of studies in other languages globally that could be perhaps put in a database for doctors and pharmacists and politicians to reference in the future.
Now, Andrew, as regards the the cannabis market at the moment. Have there been any studies to calculate, first of all, what the sales of cannabis are in Poland on the official market and for medical purposes?
Yes. So at the moment there is one product which has received registration from GIF, the Główny Urząd Farmaceutyczny, but there are, I believe, 50 products which are pending approval, and even some which may have been done over the recent period, but is not yet been publicly announced. Our understanding, and this is something which is not publicly available, is that there are between 2,000 and 3,000 medical cannabis patients in Poland right now, which actually on a European level is quite high. The leader by far in Europe is Germany, but really where everybody looks at is US and Canada. Canada is a very specific country because it has had medical cannabis legal for quite a while, and since last year it has had recreational cannabis legal. Now, recreational and medical is actually the recreational is unhelpful for the medical discussion. It's the levels of THC, the product which gets people high, is far higher in recreational cannabis than actually a lot of medical cannabis patients require, albeit every person is different, and like with most drugs, people do develop tolerance and resistance, and the THC levels maybe do need to go up. So,
right. But in terms of the the potential of the market, what is the potential? I mean, if you're thinking in monetary terms for Poland, first of all for selling products and also for production.
Okay, so as far as, let's talk conservatively. Okay, so we'll do a small number. Let's just say each patient in California, which California has a smaller population than Poland, and Poland's also roughly the size of Ohio. So we can imagine Poland like a compressed California, and they have over 100,000 medicinal patients in California. Okay. So if we were to imagine that all of the people with rheumatoid arthritis and cancer patients, et cetera, who could qualify for a medicinal program, let's just say there was 100,000 people in the future in Poland, and they were conservatively using 1/4 gram per day. That's about 90 grams per year, right? That's 9 tons of cannabis. What we have right now is a political position where we're importing only from other countries. But then again, we also have the kind of system within Europe where Poland is one of the few countries left who have very qualified millions of farmers. And so this could be, that right there, 9 tons, that's about 500 million zloty worth of cannabis, right, at 65 zloty per gram.
Now, just so people understand, hemp as a product has a long history of being grown in Poland.
That's true.
But of course, there are different types of the product which have different levels of the necessary chemicals. So industrial hemp, it can be sold in Poland?
Yes, sir. Poland, in fact, has the Institute of Medicinal and Natural Fibers in Poznan, and they're one of the oldest cannabis research facilities, government-owned. They've been around since the 1930s, and out of the 60 or so varieties of industrial cultivated variety of cannabis, which is legal to grow in Europe, they've come up with 6 to 7 varieties themselves, which is used for seed oil and animal feed and bedding and hempcrete for building fireproof houses, etc. But then we have other cultivated varieties which have a higher than 0.2% tetrahydrocannabinol, which are used for medicinal purposes.
Mm-hmm. Now, critics of medical uses of cannabis will often suggest that it may be a gateway to recreational use. What's the industry response to that kind of suggestion?
Well, the stats don't bear it out for a start. So, as I said previously, the mixing of recreational and medical is unhelpful. But misuse of pharmaceutical products is unfortunately something which is always going to be there.
In terms of opiates, for example.
For example, and any kinds of drugs, there's many examples of misuse. So that's something which is going to be there, but the statistics do show that the medical benefits are huge, and actually they are still, the amount of innovation which is happening is unbelievable. In many ways, we have this endocannabinoid system within our bodies which produces cannabinoids. We know about the benefits and how they work, about 10 of them. There's still 140 we don't know. And for example, dealing with sleep disorders, with different kinds of anxieties, it's still in the early stages of innovation. So the key point at the moment to deal with the critics is education. Education on the medical benefits, and actually the people that really need the education right now are doctors. The doctors are still very much skeptical of it.
Because they will use opiates,
yes,
but won't use cannabinoid products.
The other major parties which are against it are the pharmaceutical companies. That's unfortunately the reality. They are requiring a very high level of scientific study to be done, and obviously the key issue then is
but that's simply, but is that not good for the end consumer? That if medicines are properly tested, then we know better about dosage, for example.
Yes, but not at 250 euros a week. The issue is that the level of clinical testing means that the price becomes prohibitive, and it's not something which the ZUS refunds at the moment. So that's part of the issue.
Well, gentlemen, thanks very much for that discussion today about medical cannabis. Well, obviously this is becoming a growing market. It's a controversial topic, so please come back and join me another time.
Yeah, David, if I can maybe just say one thing. We will be doing a very big event on the 22nd and 23rd of October for the doctors and for people that want to learn more about medical cannabis and its uses and its potential.
So thank you very much for joining me.
Thank you.
Andrew Makatrevich de Roy and Michael Klepacz.
Thank you.
Thank you very much. And thank you, viewers.